afternoon, everyone. Welcome to this historic meeting organized by the European Health Forum Gastein and Santé Mondiale 2030. I'm Ilona Kickbush. I'm the chair of the Global Health Center at the Graduate Institute in Geneva, and I'm delighted to be moderating this event. I said it is historic because when we planned for this event, we did not yet know what would happen at the G7. And at the G7, Commissioner Stella Kyriakides of the European Commission announced that there would be a new European global health strategy, something that many of us had called for over a whole period of years. And so now with this seminar, we're probably one of the first groups to discuss this in a wide audience in this way. And now, of course, we have to shift. We have to shift from the advocacy mode to the hard stuff, to being clear at what such a strategy should achieve, what its content should be, and what its impact should be. So we're going to try and discuss some of that in very first steps during this meeting. So several of the recent presidencies have contributed to make this possible. A working group of presidencies was established by Finland and Germany, and all the following presidencies have continued to have global health on their agenda. And we will have two of these presidencies speaking to you this afternoon in the first part of this meeting, and that is France, represented by Christine Berlin, and we have Slovenia with Andrej Martin Vučkovac, who is advisor at the Ministry of Health. We will, after having these first presentations, there will be a panel discussion moderated by Luis Pizarro. He will introduce those speakers, and then hopefully we'll have some time for a short question and answer session. We have a very large audience. There's very great interest in the subject matter, and so I will move on quickly. Our first speaker, though, is Michelle Kachatskin, who is also linked to the Graduate Institute and the Global Health Center there, a colleague with whom I have worked for a long time. And Michelle will set the scene for us. Please, Michelle, over to you to give us an understanding. Why does Europe need a strong global health strategy, and where exactly are we now? Michelle, over to you.
Thank you very much, Ilona, and good afternoon, everyone. Yes, as you just said, Ilona, we all welcome this decision of the Commission to develop a new global health strategy. And many of you attending this seminar have been working on this and advocating for it for years. Member states, Commission, academia, think tanks, civil society, and of course, the French Presidency, who had set it from the beginning as its #1 priority. So why is this strategy needed? Well, the first and maybe overarching reason I can see is the now strongly acknowledged need for Europe to have an agreed set of principles and priorities to guide its actions and investments in global health. And for the Commission and member states, the need to speak one voice, that's the title of our seminar today, in multilateral fora and in all global decision-making processes in health. So just as the EU is paving the way to an internal European health union, it should also build its external face as a strong and united interlocutor and actor in global health. Another reason is the full recognition now that by Europe that national and regional health are tightly interlinked with global health. And certainly the COVID-19 pandemic has anchored this concept. No one is safe unless everyone is safe. And the pandemic has prompted a number of, I think, decisive joint initiatives and joint strategic reorientations within the EU. But global health, of course, is of significance beyond just the response to pandemics. Health transcends national borders in many ways, and many other health issues, of course, can only be effectively addressed through global collective action. Another point maybe worth bringing now is that most of the social, economic, environmental, global determinants of health are interdependent with other sectors, such as the One Health, such as climate change, security, or trade and technology policies. And here we have a good precedence in Europe, for example, of joint strategic commitments, almost a strategy of the EU on global issues in climate change, such as the decision to reduce green gas emissions under the Paris Agreement. Adopting a strategy will also allow the EU to promote the values it defends in the global arena, the values of the universal human rights framework, those of equity, solidarity, cooperation, and here I'm using the wording of Commissioner Kyriakides, and Europe's commitment to multilateral dialogue. I feel that the voice of the EU needs to be forceful on these values. Next, a robust European global health strategy will further help shaping Europe's development assistance and build international partnerships in health, and particularly with our neighbors, Africa and Eastern Europe. And maybe the last and somewhere obvious reason that I'd like to bring for developing a new strategy are the major changes that global health and geopolitics have undergone since 2010. And 2010, you will remember, was when EU member states and institutions first agreed to, and I quote here, act together on global health in all relevant internal and external policies and actions. And clearly those 2010 Council conclusions predated the Sustainable Development Goals, the outbreaks of Ebola, the Paris agreements on climate, and of course the COVID-19 pandemic. And they preceded the major changes that have occurred in the last few years in international relations and in the multilateral order, changes that will profoundly impact on how Europe will position itself to address key issues in global health, be it on preparedness and response to pandemics, access to global common goods, or reforms of the global health architecture. In the press conference that followed the joint meeting of Ministers of Foreign Affairs and Ministers of Health last February, Minister Le Drian, the French Minister of Foreign Affairs, said, quote, "Global health is a geopolitical issue." And that may be one of the main reasons why Europe, particularly in today's global context, does need a global health strategy. Thank you.
Thank you very much, Michel, for this very precise and clear introduction why we need such a strategy. Let's hear from two presidencies now. First, from the Slovenian presidency in the second half of last year. We have with us, as I already said, Andrej Martin Vukovac, and we would like to hear from you, Andrej. What steps were taken during the Slovenian presidency to actually move this agenda forward? Over to you, please.
Thank you very much, Ilona. It's an absolute honor to be in such company today. And I would like to thank the hosts first, the European Health Forum Gastein and the Sante Mondial 2030 for inviting us to speak at this event and share some of our experience and developments that happened under the Slovene presidency. And I think I can say that it was a very busy time for global health during the presidency. as we were still well and truly riding the wave of the pandemic and the political importance it was given globally, which might not always be the case today. So we had quite a few productive discussions and events and developments, and I'll just highlight the cherry pick the top of the top, let's say. So I would start with the WHO Regional Committee in September, where I would particularly point out the adoption of the report of the Pan-European Commission on Health and Sustainable Development, which is chaired by Mario Monti, which very strongly recommends several actions, including investments in health systems nationally and globally. And this has received quite high political support, including from our Prime Minister at the time. Then in October, there were other two events organized by the Slovene presidency, one in a very similar forum as today, so the European Health Forum Gastein on strengthening health systems worldwide, what's next for the EU global health approach, and then later on in the month, a virtual conference on the role of the European Union in the strengthening health systems resilience globally. And both of these sessions particularly focused on health systems strengthening and resilience, which was one of the key themes of the Slovene presidency. And a key takeaway from these sessions was that focusing on health systems is often a forgotten but a fundamental aspect of global health. And this can be maybe food for thought also for as we build the global health strategy moving forward. Then at the end of November, I would also like to point out a very historic event in Geneva, the special session of the World Health Assembly, which was dedicated to considering developing a new WHO convention agreement or other instrument on pandemic preparedness and response. And I think this was one of the highlights in global health in the recent years. And why I particularly mention is because the EU and its member state have played an enormous role in making it happen. They were really the engine behind adopting the decision that now moves us forward to a new important part of the global health architecture globally. And there are actually negotiations that are taking place as we speak in Geneva. And finally, another highlight were the Council conclusions that were adopted in December with a specific section on global health titled Strengthening the European Health Union, the role of the EU in global health. And I believe that these conclusions capture quite well the main content elements that have emerged during the whole presidency and the events that I have listed already. And I think those can also be very relevant to inform the content of the upcoming strategy. And the first point I would there make is that in the conclusions, it stated that we should explore new options for a joint action on global health, encouraging the use of existing mechanisms such as the EU for Health. We should continue to demonstrate a leading role in global health, where I can attest that the EU definitely has a strong presence, at least in Geneva, where I mostly work. But this is very organic, so maybe a bit more structure to that would be very useful. And then moving on, investments into global health we're also highlighting during the course of the presidency, and this can be found in different forms, either in investing in internal resources, education and capacity building to deal with global health issues, but even more so, as was mentioned earlier today, how to resource resilient health systems globally. And finally, an important point was also made on collaboration and partnerships, both among the member states within the EU, but also beyond it, and also non-state actors, which are an important stakeholder in many of the challenges that we're taking on, and we cannot manage them working in silos. So we need to be open to wide and diverse partnerships, especially when tackling issues like One Health and antimicrobial resistance, just to name a few. And with that, I would bring this summary to a close. Thank you again for this opportunity to present some of the highlights from our presidency, and really looking forward to other colleagues' presentations. Over to you, moderator.
Thank you very much, Andrzej, and thank you also for indicating how much the work that was done during your presidency can also help identify priorities. And when we speak of priorities, what you said, you know, not just only issues, but also perhaps new structures and processes that might need to be put into place. It's now my particularly great pleasure to welcome Christine Belin, who is the head of International and European Affairs, Ministry of Health and Prevention in France, and who was a driving force for the discussions and the movement on EU's role in global health during the French presidency. Christine, tell us what you were able to achieve and why you look so happy right now.
I wanted first, to extend this special thanks to you, Ilona, to Michel, and to President France, for your valuable contribution to the French presidency endeavor in global health. This is why I was smiling. You introduced me as instrumental. Yes, I mean, we've been working together with presidencies starting under the Finnish presidency as a group, I mean, to reflect on the revision of this global health, European global health strategy. And of course, I mean, strengthening this European leadership in global health was at the forefront of our presidency. And Michel, I mean, recall that it started with this joint ministerial conference convened in Lyon. Michel quoted the French Minister of Foreign Affairs, but I would like just to point that all the ministers at the group during this meeting acknowledged the need to endow Europe with a stronger voice and to revise, I mean, the European global health strategy accordingly. And really they reiterated a commitment as Team Europe to strengthen the multilateral health architecture with WHO at its center and to support, I mean, in particular, low and middle income countries. So today we are just, I mean, delighted that the European Commission, I mean, recently announced to launch, I mean, the work towards this renewal of the strategy and the ambition to deliver by the end of the year. So my understanding is that the political work, but Paco will explain everything, I think, during this meeting. So the political work on the revision will start at the EBSCO Council meeting next Tuesday, 14th of June. And the minister will be asked, I mean, to frame the ambition and the goals and to define the headline of this new strategy and coordination mechanism. I just wanted to share, I mean, quickly with you some preliminary thoughts because I will have, I mean, to leave and will not be able to participate to the debate, I mean, that you organize in this meeting. But what I strongly believe is that the new strategy will really have to offer a strong and innovative European vision. We'll have to grasp, I mean, the long-term climate and environmental changes. It will have to convey our value and social goals, and as Michel has said this already. To develop this multi-sectorial approach, I mean, to health, we will need to engage, I mean, research, trade, economic sectors, and really to have a view on implementing this health in all policies, which should be central, I mean, to the revised strategy, like equity, solidarity, transparency, accountability, all the values and the grounds that we have, I mean, to implementing this new strategy. I think we have to define some flagship initiatives and really bold actions that will represent the European signature in global health. And in various areas, just like mental health, digital health, health promotion, well-being, access to care, migrant and refugee health, etc. I mean, just to mention a few, we will have, I mean, to decide how to arbitrate between all these burning, I mean, challenges that we face in the global arena. I believe also that the new strategy will have to offer an overarching frame and governance system for the EU member states to coordinate their own national priority in global health if we really want to achieve impact. I really hope, I mean, that the new global health strategy will truly embark, I mean, all the stakeholders in a common narrative, and that the strategy will be grounded on the development of partnership and a rule-based cooperation. I will have, I mean, to quit the meeting, unfortunately, and I just want to wish you all the best, I mean, for the discussions, and I will look forward, I mean, for the meeting report actually, and to, I mean, continue working all together with European Commission, member of the trio presidency, all of you. Thank you very much. Thank you.
Thank you very much, Christine. Thank you for these very, very concrete points that you also put forward. I think already in the three presentations we heard right now, a number of elements to shape such a strategy have come together. I think one of the points I'll just highlight before I hand over to Luis is that the strategy, of course, is both a coordination mechanism within Europe, within the Commission, but also to link national strategies with European and global strategies. And that also takes us back to Michelle's point about the global health strategy and the strategies for a European health union being very closely intertwined. The internal and the external dimensions of the European Union are incredibly important here, and that will need to be a key theme. So thank you to the speakers in this session. Thank you very much. And I hand over to Luis without further ado. Please, Luis.
Thank you very much, Ilona. Good morning, good afternoon, everyone. Please let me start by thanking our colleagues from Gastein Institute that are putting that in place with us, Santé Mondiale 2030. And of course, thank you, Ilona, not only for today, but for the strong engagement to make this European strategy happen. I'm Luis Pizarro. I'm the Director of DNDi, Drugs for Neglected Diseases Initiative. I'm also Director of Global Health at Sciences Po Paris and the Secretary General of Santé Mondiale 2030. Our idea for this panel was really to bring different perspectives on how this historical moment, as Ilona framed it at the beginning, will be really, it's going to become concrete because it's not more about having or not having a new European strategy. Now we know it's going to happen, and we want to discuss with all the panelists on how it's going to this strategy happen, what is going to be the process to go to this strategy, and of course, what is the content, what are the priorities we want to see within this new strategy. So as you see, we have 5 panelists. We asked them to address very specific points, each of them. And of course, we will try to keep some time for your questions. You can really send your question on the Q&A file you have here in the Zoom meeting. We wanted to start with our colleague, Anders, that most of you know very well, Anders Nordström. He's the Swedish ambassador for global health at the Ministry of Foreign Affairs in Stockholm. Anders had a long experience at WHO. He was the ADG for General Management Health System, and he was also acting as Director General between 2003 2008. Anders also worked in Sierra Leone for WHO during the Ebola crisis, and he has been Director General for the Swedish International Agency. I'll try not to be very long presenting all of you. You have, of course, the bios in the website. You can have a look there. So Anders, please, we wanted to start with you to have an historical perspective where we come from 2010, the first global health strategy of the European Union, very MDG approach, and what are your main priorities you would like to see in the next future? Please, Anders.
No, thank you very much, and delighted to be with you. A lot has, of course, happened, not just during the last 2.5 years when we have been experiencing the pandemic, but also if we look back to 2010, at that time, we were still, I would say, in the MDG era, and that communication and strategy was very much influenced by then the MDGs focusing on health, which in some way was very successful, because what we've seen happen with those very clear goals and targets focusing on maternal mortality, child mortality, AIDS, TB, and malaria, we have basically during the last 20 years reduced mortality, number of people that we have lost because of those 3 areas or where we have focused the goals with more than 50%. So big success both in terms of child mortality, maternal mortality, and AIDS, TB, and malaria. We still have an unfinished agenda, but we need also to get the perspectives right in terms of what is really affecting people's health today. And big picture, if you simplify it a bit, is that the transition across the world, not just here in Europe, is moving towards the non-communicable diseases. So we have 16 million people, almost 3 times as many people dying from the combination of child mortality, maternal mortality, and the 3 diseases today dying prematurely from NCDs, meaning before the age of 70. 85% of those are dying in low and middle income countries. Those diseases that we have traditionally associated with wealth and being rich is definitely not the case. It's the lower socioeconomic groups in our societies in Europe that are mostly affected. Same thing in the US, in South Africa, but also we see this transition now happening rapidly also in low and middle income countries. So if we're going to look forward, we need now a strategy for EU and its member states that resonates with both the epidemiological reality, what are really the health problems, but also understanding what are the underlying mega trends that are influencing this. And we have learned a lot from the pandemic now in terms of what we need to do, which we didn't do and which we didn't have in place. I was just listening to somebody else who said that the pandemic has been a success for evidence and research and a failure for politics. And I think there is a lot in that. So, I mean, Sweden, we are right in the middle of, or right now beginning to, or we have already started the preparation for our presidency in 2023. And we are trying to see how we can be as helpful as possible. And of course, we have a strong interest in the global health. So we are thrilled about that now the 2 commissioners have now announced the starting of developing a new strategy for us, member states, and the Commission. And we'll see how we can support that when we come to our presidency. But in terms of substance, what we need is basically a strategy that is more building on the Agenda 2030, with an understanding of this as a joint common responsibility and opportunity for all countries across the world. This is no longer only about aid. Development assistance is important, but what we are faced now with, whether it's climate or whether there are global health threats, is for the world. And we need a strategy that is basically managing now to look at, you can build it on the WHO 3 billions and the pillars. Threats, how do we manage threats? How do we ensure everybody's equal right to good quality health service regardless of ability to pay, UHC. Second element, that is crucial for us and is also in line with the values of us here in Europe. But the third pillar here, which is possibly the most important one and most difficult one, is also to recognize the underlying social determinants for health and how that has influenced risk factors. Because what we've seen during the pandemic is also people that are more exposed to the risk, they have been more vulnerable. So dealing also with issues that has to do with obesity, food, air pollution, clean air, the fossil fuel, what is good for the planet is also good for people's health. That needs also to be one of, as we see it, or I see it, one of the 3 components in a modern strategy for EU member states and commissions engagement in global health. And my last comment is that what we've seen also during the last years is that we have stronger regional bodies. And I think the EU also needs to work hand in hand with the African Union now, who has a much stronger political engagement and capacity for health. The same thing for ASEAN and the same thing for the Americas. So I think we need to think from the European perspective that what are we doing at national level? What are we doing regionally? And what do we need in terms of global functions and where we need also to join hands with other regional partners? Thank you.
Thank you very, very much, Anders, for setting the scene for this discussion. And I think we received very strongly your message about this full context that is changing, it's being reshaped, and we need that to take that into account. So as we said, it's an historical moment because there is now a dynamic in the European Commission, and that's why we thought that it would be extremely important to follow this discussion with Francisco Pérez Cañado. He's really the good person to address this because he has joined the European Commission DG Santé Health to advise Director General on international matters. You are going to coordinate the work to shape this new EU global health strategy that will be co-led with DG INPA, the international direction, former DevCo. You have spent most of your career in DG Trade, covering a vast variety of topics and interacting with a lot of stakeholders. And as I said before, please, if you want to have more details, go to our website. So I really want to give you the floor now, Francisco, just to expose how the European Commission will start addressing this new strategy. Up to you. Thank you.
Thank you very much, Luis. And with my long, unpronounceable Spanish name, I always tend to ask colleagues to please call me Paco, because otherwise you won't be able to pronounce it. Indeed, I want to thank the organizers, because this could not come at a better time after the 19th May announcement by two commissioners, Commissioner Kyriakides, but also Commissioner Urpilainen, that we would be starting with the process of updating our 2010 communication. The fact that we have two commissioners leading and co-leading the work underscores the importance of recognizing the nexus between health and development, but also with other areas. I'm going to do two things now. I'm going to throw at you some questions that we are looking at, so that you understand a little bit what our thinking process is being. And then I'm going to highlight to you a little bit the contours of the consultation process, because this is more than anything else an opportunity for us to start, well, actually to continue to listen, but more intensively so, as we move towards defining through a new communication what the Commission thinks would be the way forward on a global health strategy by the end of this year, which is a relatively compact time frame. To go to some of the questions that we're looking at this stage. Well, we have been focusing pretty much over the past couple of years, of course, on dealing with the pandemic. And this, of course, must form the basis of any, a strong preparedness and response policy vis-a-vis the pandemic must form a fundamental part of any global health strategy these days. But of course, this PPI issue is fundamental, but our thinking process is to look beyond this, of course, and to the broader objective of promoting and protecting health and combating health threats. And this means that we're going to have to look at priorities. I think a couple of the colleagues from member states have said this before. We're going to need to focus on priorities. It's a very complex field, but nonetheless, this will be very important. Probably four questions come to mind, between 4 and 5 come to mind there. First, should we not refocus our priorities more on strengthening health systems, which are fundamental to underpin any global health objectives that you wish to achieve? Should we not also focus on better health and in general the meeting of very important SDGs and in particular, for example, UHC? Has this not falling a little bit by the side of the road? How do we bring together the One Health conundrum into the equation? Because it's, the nexus between environment, animal health, plant health, and human health is absolutely fundamental. The interconnectedness that many of the speakers have mentioned before, how do we bring that into the process? And the last question, how to best to pursue our values and in particular equity? We've learned a lot from what we have been doing when facing the pandemic, and this has been one of the equity issues is an issue that has been, I think, fundamental. More questions, how to best to project EU leadership, because it is fundamental, it has proven fundamental in order to rise to global health challenges. How do we do this? Shouldn't we lead by example in the promotion of our values and health outcomes? This resonates with a lot of the comments made before between the internal aspects and external aspects of our policy. How should we enhance coordination to speak with one powerful voice? The questions I've heard a lot of talk about a global health architecture since I have joined this fantastic area. But I think that we basically go beyond this. We're building a new global health order, not just an architecture. So how do we shape it in order to achieve full promotion and protection of global health? How do we best support multilateralism with the WHO at its core? How do we complement that with work with plurilateral organizations or platforms, G7, G20? our flagship of expanding our partnerships and their power to deliver results. How do we, define that in a way that is supported and achieves our health goals? And most importantly, also, how to best engage with the myriad of actors and initiatives that have emerged, in order that at the end of the day, and here I go back to the priorities theme, we're able to engage with them in a meaningful way to achieve the priorities that we set for ourselves in the EU. The last block of questions that we're asking ourselves is how to ensure sustainable financing that delivers our goals with our Team Europe approach. And this, again, will need to better link all the actions that we have with our priorities and ensure that we have, as I think Christina said before, a clear set of guidelines to help us coordinate all our efforts. And of course, how do we monitor all of this? I think it'll be fundamental that we are looking throughout the period where this strategy could be operational, which could be until 2030. How are we making sure that we stay on track, enhancing also consultation and participation with stakeholders? So those are the questions. Now, Luis asked me basically to focus a little bit on that. If I can take one more minute, or Luis, do you prefer that I talk about?
Yeah, maybe
at the end.
Maybe let's keep it, because probably we'll have more questions at the end, and I see the time's going on. So thank you very much for that, Paco, if you may. And of course, we have now, Anders set the scene. We have Paco explaining how the European Commission is thinking about that. But we thought that it was absolutely fundamental to have three other perspectives now to start filling this strategy. And we would like to start by people who are outside of the European Union. We asked Obiageli Ezekwesili. I know you like, I call you Obi, if you may too. You are a very well-known person in our global health sector. You are a senior economic advisor for the Africa Economic Development Policy Initiative. You are one of the co-founders and directors of Transparency International. You're also the founder CEO of Human Capital Africa, and you were the founder chairperson of the School of Politics, Policy and Governance in Abuja. You have been vice president of World Bank Africa region in Washington, and you have served, of course, the government of Nigeria between 2000 and 2007. So we are very pleased, very honored to have you with us, Obi, and we know that you will tell us with a very transparent and candid perspective what are your recommendations and how do you see the role European Union should play in this new global health architecture. Please, Obi.
I am careful to not trade video for effective delivery. And so if you don't mind, I would have to just be on voice. And if I see stability, I can then put on the video for the next 3 minutes that I have or so.
Perfect.
Is that okay? All right, excellent. So first, I really want to thank you for laying on this important conversation and to say that every conversation around what Europe is trying to forge around global health policy is necessary to include Europe's neighbor, Africa. And I believe that it was with that in mind that you invited me to be part of this conversation today. And so I believe that the first thing to establish is that we cannot imagine a global health policy that assumes the insularity approach that we always love in the world of multilateral relationship. We cannot take health and build a silo around it, no matter how fantastic the policy would turn out to be, assuming that we were able to get shared values and shared principles amongst the European countries, and they actually came together around a global health policy that's acceptable to all of Europe. How about all the other issues that are related to the state of our multilateral order? And so I believe that the number one thing to establish is the contextual environment within which this conversation on health is happening. And I believe that the aftermath of the pandemic clearly point us to the fact that health is economy and economy is health. And that, you know, the era when health practitioners could have the solution for health issues without being mindful of how it connects to security issues, to issues of trade, to issues of, to issues of the economy, to issues of even geopolitics. That era is gone. And so it is important that we should identify what the lessons of the pandemic are in terms of relationship between Europe and Africa and the rest of the world within the context of a broken multilateral order. And then the second set of my comment would be that there is a whole knowledge agenda that is important for global health. Now, this knowledge agenda has to be one that is inclusive in the way that Europe shapes its global health policy. There needs to be that inclusivity in the process of the underpinning rationale and the underpinning evidence that would guide the direction that global health policy should go. And I believe that that would call attention to the challenges of the economic disparities that have to be considered. The truth is, financing global health in order that health would not be the exclusive preserve of societies that also have the economic strength to provide a threshold of health as services to their people is important. How do we deal with these very sharp inequalities within and across borders, and in relation to how the consequences of global health challenges touch on the poor more disproportionately than even regions where these things could emanate from? So how do we insulate against the deeper challenges of inequality as a result of ignoring the issues of economic existing entrenched inequalities in health, in the health system? And then number three, and I think that's where I begin to conclude my point. Number three is that for us to discuss the global health policy issues, I think that it is important to acknowledge that we must look at existing international systems and tell ourselves the truth as to whether they serve us well. Do the existing systems serve us well? Are we going to be so politically, correct in not accepting that the UN systems appear to be facing their sell-by date? You talked about my being candid in this conversation. I want to be candid and say that if we do not have multilateral institutions that are organized on the basis of global governance that is equitable, we kid ourselves to imagine that a health policy designed by Europe within these existing constructs that do not include inclusive governance of institutions that are of global relevance would do well for us. So I am not one of those that think of let's reform on the margin. No, I am one of those calling for a redesign of our multilateral order. We have to reimagine and redesign because today's problems are completely so different, and we must be ready to embrace them with the kind of clarity that evidence offers to us as to the non-workability of what we're currently adjusting ourselves to. So I thank you for the opportunity of sharing these few thoughts, and I look forward to listening to the rest of the discussion.
Thank you very, very much, Obi, and that was exactly our purpose, because we all think that this strategy cannot be designed without engaging this dialogue with our friends and with all the stakeholders who will be part of this new, architecture you are mentioning. So that's why also we wanted to have not only a government perspective in this discussion, but the civil society one. And we asked Gianmarco, who is serving today as an advocacy officer from DSW Brussels office. You are specialized on the EU institutions and global health. You have been in the past working also for global health advocate, also here in the EU external action. You have a background on international relation and a master degree of University of Turin. So Gianmarco, please, I know you will not represent all the civil society from the European Union, but you know very, very well how those organizations are thinking about today. Please, Gianmarco.
Thank you very much, Luis. And yes, I'm very happy to be able to speak today, also providing the perspective of civil society organizations working in the area of global health. And I'm specifically happy that we don't need to convince anymore about why we need a new global health strategy, but we can actually focus on the content and what this new global health strategy should look like. I'll try to focus on three main points. First, about the process that we believe should lead to the adoption of the new strategy. Then a bit about the content, so what the strategy should look like according to our views as civil society. And then finally about its implementation. And I'll try to answer to some of your questions, Paco, in between my intervention. So first, a few words about the process. I think that the new global health strategy should be informed by meaningful and inclusive multi-stakeholder consultations, including also from actors from low and middle income countries. And I think that the Global Health Policy Forum that will actually take place on the 21st of June at the European Development Days in Brussels will be a very welcome first step in that direction. Of course, it cannot be the only step. This forum needs to be revamped also to ensure long-term and regular exchanges and consultations between the European Commission and civil society. Civil society and communities should have a key role in the development and in the implementation of the strategy, especially because of the really great expertise that many civil society organizations have in implementing health programs, especially reflecting the needs of population and communities, often living in marginalized and vulnerable settings. And then another actor that I believe should be important to involve that hasn't been mentioned so far is the European Parliament, which I think should have quite a critical role both in the development, implementation, but also in the evaluation of the strategy. In the past years, members of the European Parliament adopted several resolutions and recommendations with quite strong messages on global health. And I really think that the new global health strategy should try to incorporate and take all those recommendations from the European Parliament into account. Finally, also, I think that health and other thematically relevant focal points from the European Union delegations around the world should be encouraged to participate and be involved in the development of the strategy to ensure a more coherent approach of health interventions. Then moving on to the content of the strategy, also trying to answer to some of Paco's question. Well, I believe that the overall objective of the strategy should be to strengthen health systems in partner countries and to achieve UHC while leaving no one behind. At the same time, the strategy needs to address health inequities and also the social, economic, and environmental determinants of health through a strong rights-based approach. And this includes, importantly, applying, for example, a gender lens to the different elements and priorities of the strategy to ensure that we jointly work towards gender equity in global health. And then at the same time, I believe that the strategy should really act as a compass, acting as a tool to coordinate different actions of the European Union institutions in the area of global health. It should apply to all actors of the European Union involved in global health and whose action have an impact on global health. I'm thinking about areas such as research and innovation, trade, migration, human rights, water, climate. And this is why it's very important for all relevant departments of the European Commission to be involved both in the implementation, in the development, and in the integrated implementation of the strategy, with the health in all policies principle at the basis. And then any strategy is as strong as its weakest link. And this is why we really believe that the strategy should tackle the key persisting, neglected, and emerging global health challenges that were largely absent from the framework in 2010. I'm thinking about sexual and reproductive health and rights, antimicrobial resistance, poverty-related diseases. So these issues that were quite neglected in the previous framework should be at the core. Final word, I know I'm probably out of time. This needs to be translated into stronger plan of action, backed by stronger monitoring and evaluation mechanism. And of course, policies alone are not enough if not backed by a robust funding framework. So definitely the ambition of the EU needs to be backed and matched by a scale up of investments. The EU is lagging behind compared to other major international donors when it comes to health ODA. This needs to be matched and scaled up in the future strategy. Thank you.
Absolutely. Thank you, Gianmarco. And of course, from here at the NDI, we will push for this need to address those neglected topics in the strategy. So we have very short time. After the French presidency, we'll have the Czech Republic taking the presidency of the EU next semester. And that's why we wanted to finish this round of intervention with Elena Steflova. Elena has been working in several positions in the Ministry of Health in the Czech Republic. He has been also leading the WHO office in the Czech Republic too, and is also filling different academic positions. So Elena, it would be very, very important for us in order to think about the near future to have your feedback on how the Czech Republic and different stakeholders in your country will address the next 6 months. Elena, please, and try to keep it very, very short, please.
Yes. Let me say that if we are looking for some unified European strategy, we must to negotiate it, what we are doing. And I just guess that it was said that this webinar is really one of the first public opportunity, and thanks to organizer for that. Just we are now in the phase when the French colleagues are initiating this process. And on my behalf, I am very glad that the next presidency will belong to the Czech Republic, starting already the next month from July. And regarding this document, it's expected to be prepared for broad discussion, for public consultations, and especially to ensure that all countries will have the same opportunity to comment it. I would like to highlight that the Czech presidency intends to cooperate closely with the French colleagues on the design of proposed action on global health. We are also committed to a very active collaboration with the European Commission on the communication on the global health, which I recognize as a very, very important step forward. We are also like to ensure everyone that the Czech Republic is ready to start this process, to devote maximum attention to it, and the country can provide platforms for an open discussion and use already planned meetings under the Czech presidency to formally or less formally advocate for this initiative and foster the whole process of its adaptation. Of course, with the respect that this process will continue beyond the Czech presidency and will be in the hands of Swedish colleagues. At the same time, I would like to also add that I am honored to be a member of a standing committee of regional committee to WHO regional office, and therefore I can also promise and even guarantee, because I already spoke with the leaders of this organization, that the strategy will also be in line with opinion of this office and of this organization and fulfill its position, directions, and objectives. I think that it's a very, very important, because it's really the organization for global health under the system of whole the UN. And moreover, Czech Republic every time fully support the coordinations between Brussels and Geneva, and as well as Denmark or Copenhagen, where is located the regional office. I would also like to mention and focus on the process itself, how to make it happen. Even when we are talking about global health, states must feel that they find solutions also for health-related issues that affect public health and health of their citizens. At the same time, the strategy must be understandable for the government and for the particular sectors. Especially it's important for ministries of foreign affairs, because it will be the very important political international document. But we already spoke about the impact on environment on health, about the role of transportation, about the role of industry, and also we need to educate children, educate adults, but also we need to involve scientists and researchers for looking for new solutions to future. What I feel as very important is also to build bridges and not trenches between states. It maybe seems to be very general, but I think that it's really very, very important, and maybe some attitudes needs to be changed, because we are in the situation which is maybe more critical than ever before in modern history, and it requires some keeping balance of opinions and attitudes and relations among particular states. It means to speak with one voice is our response, and maybe only the solution. And I think that to implement the motto of this webinar into reality, it's probably the way how to do it. And the motto is very nice. I like it. And so thank you for your attention, and pass the word to you back.
Absolutely. Thank you very much, Elena. I see that we have run out of time, but thank you very, very much to all the panelists for being with us this afternoon. And I would let Ilona maybe with some final remarks to end this panel. Ilona, please.
Thank you very much. I won't say as much as I planned. I want to thank everybody. I think it was very, very rich. I think we must do a good summary of this meeting because it will surely inform all the discussions that are coming up. I want to underline again the need to be clear, to set priorities, to be clear about the strategic direction that we want to achieve. I'm a bit reminded what Charles Michel said about the treaty negotiations at the WHO. He said, we cannot afford to have a Christmas tree. And I think we have to be very, very clear in this strategy what it should achieve politically, strategically, what it should achieve in terms of values, and what was highlighted frequently in terms of the inequalities the world is facing, how it should act to cement partnerships and not divide the world. And I think those are some of the big challenges that we have, that we must pick up and that we must resolve, as Paco told us, by the end of this year. And I think using that window of opportunity wisely is going to be one of the most important challenges that we have. We do not have much time. We have a window of opportunity. We have attention being paid to global health. We have political commitment, and we need all the political actors behind that. I'm glad that Jan also mentioned the European Parliament. This is a process of member states, of Commission, of Parliament, of many stakeholders, and that needs to be organized well. So I hope that the European Health Forum Gastein, also in cooperation with other partners, just as with Santé Mondiale 2030, will take this conversation forward, will see itself as a focus of some of these discussions that can input in a whole variety of ways. And I'd like to thank you all, and I'm sure the Commission and will be happy for as much input as possible, so that it is really a strategy, not just of European institutions, but of Europe, that the voices that are out there, remember the Conference for Europe that prioritized health very much, that these voices are heard and can be reflected in the strategy. Thank you to everyone. Thank you to the audience out there. And we hope to see you again in different setups and ramifications. And hopefully at the end of the year, we can celebrate and we have a strategy. Thank you.